We get the grim list every Wednesday, the weekly death file, containing the names of those who have died from COVID-19. But this week, we spotted something we've never seen, a new description for a secondary cause of death: social isolation, failure to thrive, related to COVID-19 restrictions. His name was Chester Pesky. He died last week, 4 months short of reaching 100. The World War II veteran spent 2.5 weeks alone, isolated in his room at a Twin Cities memory care unit. He had tested positive for COVID, but was asymptomatic. Pesky's primary cause of death was Alzheimer's, but the secondary cause was social isolation from COVID-19 restrictions. In other words, he died in part from loneliness. And in this, he's not alone.
She's my auntie.
Barbara Loken's aunt survived COVID-19 at St. Therese in New Hope, where at least 60 others have died. But now, 91-year-old Millie Harms might be dying of a broken heart. She hasn't seen her family in 3 months. Her niece believes she is losing weight, and the spark in her eyes.
Well, it just breaks my heart that her kids can't go see her.
Thousands of Minnesota seniors in assisted living and nursing homes are going on their 4th month of lockdown. No visitors, no activities, no communal dining, and their friends are dying around them. Studies show isolated seniors have higher rates of heart disease, stroke, and dementia, a mortality rate comparable to those who smoke, are obese, or chronic alcoholics.
What does surprise me is now we're 3 months in and we still don't have a comprehensive plan for testing.
State Senator Corinne Housley wants the Minnesota Department of Health to allow visitors back into the facilities. She's introducing legislation tomorrow that would require long-term care centers to test all residents and staff and create comprehensive infection control programs.
These people now need some sort of testing so they know who has it, who doesn't have it, and get those family members back together, because that's what's really hurting people right now.
Housley says one way to ease the restrictions would be to require visitors to get COVID tests 48 hours prior to seeing their loved ones.
We are allowing staff members, obviously, to go in and out. There got to be ways to do it in a reasonably safe way.
U of M aging expert Elon Caspi says visitors are often the eyes and ears of vulnerable residents.
We are starting to receive reports on residents who are severely harmed in different ways, including mistreatment as well as deaths.
I would tell the Minnesota Department of Health to do everything that they can do and do it as soon as possible.
Barbara Loken desperately wants her aunt to see family again. How sad it would be, she says, to survive COVID, only to die from the isolation.
We're robbing them of the fact of being able to be with their loved one before they pass away.
The health department tells us they know how important social interactions are for seniors. They say it's one of the most heartbreaking parts of this pandemic. But they are working on guidelines right now that would allow for more social interactions with seniors at windows or outdoors with their families. They expect to announce those guidelines very soon. For the Fox 9 investigators, I'm Tom Lydon.